In other news, a Singapore study has found that a mother's mental health during pregnancy may shape her child's risk of developing depressive symptoms years later. Researchers analysed data from 523 mother-child pairs in the Gusto birth cohort. They found that positive maternal mental health, such as well-being and resilience, was linked to stronger language development and fewer depressive symptoms. Negative maternal mental health, like anxiety or depressive symptoms, were linked to weaker executive function and more depressive symptoms later in childhood. But scientists stress that maternal mental health does not determine a child's outcome, with findings pointing to the need for earlier support for both mothers and children. And here to share more about the findings is Dr. Huang Pei, who is senior scientist at the A-Star Institute for Human Development and Potential. Dr. Huang, welcome to the show. Now, your study suggests that a child's risk of developing depression could be influenced from their mother's mental health during her pregnancy. Now, what are some of the common stressors that a mother could face that would impact their mental health?
Yeah, so actually in science, pregnancy has actually been increasingly thought of as a stress test for the body because the mother undergoes hormonal, emotional, and physical changes. So all of this really exerts stress directly on the mother's body. In addition, external factors such as finances, work problems, or relationship pressures can also contribute. At the same time, I think it's important to highlight that these stresses are often shaped by the wider environment and shouldn't be attributed to any failure of the mother.
Yeah, and speaking of these stressors, does the knowledge that their mental health could impact their child's unintentionally then cause additional stress to mothers? And how can health practitioners convey these findings without making them feel pressured or responsible?
Yeah, I think that this is definitely a genuine concern. And I think that one thing that we must do is to highlight that no mother chooses to have poor mental health, just like no one chooses to fall sick, right? So mothers should not feel guilty about having mental health issues in the first place, much less feel guilty about the downstream effects of poor mental health. And in addition, the novelty of our research is actually highlighting the importance of positive maternal mental health and how it exerts a protective influence on the child. So I think that moving forward, the message can be something along the lines of supporting mothers when they are struggling and how supporting these mothers can actually benefit their children as well.
And speaking of that support system, what would the findings mean then for doctors or those working with expectant mothers? Do you see any gaps in the current system that future policy could address?
Yeah, so I think that healthcare providers can help by asking about emotional well-being and identifying difficulties early so that mothers that need support can be connected to the appropriate resources. And I think one gap that we try to highlight in our study is that there's a need to assess for positive maternal well-being and for support for the mothers and not just focus on the negative symptoms.
Now, for those of us who are around or close to expectant mothers, what are some practical forms of support that could help to build a more positive maternal well-being state during pregnancy?
Yeah, so I think that support definitely begins at home. So I think that husbands play a very critical role because, as we've mentioned, pregnancy is a stress test for the mother. And it's important for the husbands to support, affirm, and care for the wife. And a similar role can be played by like friends and family, where you can like check in and ensure that they're doing fine, or just like keeping in contact and making yourself available for them so they can reach out if they need any help, can help these mothers feel connected and supported and improve their positive well-being.
Yeah, and zooming out
And
into
at a
the
more societal level, sorry.
and zooming out into the wider healthcare ecosystem, Dr. Huang, looking ahead, how can that better adapt the ways that the mother and child are supported in their mental health?
Yeah, so I think first and foremost, we should point out that Singapore actually has has already emphasized on maternal mental health, and they already have mental health screenings as part of like routine care at NUH and KKH. And I think that based on our key finding of the importance of positive maternal mental health, um, there should be a move to encompass positive maternal health into screenings And we have been conveying these findings with like relevant stakeholders such as MOH and healthcare institutes to help contribute to the broader evidence base. And hopefully this can help inform future policies.
Dr. Huang, thank you for sharing about these findings with us. That was Dr. Huang Pei, who is a senior scientist at the A-Star Institute for Human Development and Potential.